Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University. And I'm pleased to provide the COVID-19 pandemic update with data accurate through October 14th, 2021. This week, I'm going to answer a question that I get asked quite a bit, which is what questions do I have about the pandemic? What do I find confusing or uncertain about it? And there's actually 4 questions for me. 1, why are the symptoms so variable between different people? 2, is there any pattern? Is there any way we can predict what's been going on or what will go on, whether it's seasonal or some other pattern? What will happen in the long term? And most importantly for me as an educator, how can we rebuild the public's confidence in public health? In terms of the symptoms being variable, it's not unusual that viral diseases in humans have different symptoms. I mean, there's hundreds of viruses that can cause disease. They can range from very minor illnesses to lethal. Some affect only one organ, the liver, the brain, or the heart, while others can be widespread. Some cause acute disease, some cause chronic, some cause recurrent, some do all 3. Some viruses like smallpox cause disease in almost everyone. Others like COVID and polio are only in relatively few people. So it's not the fact that COVID acts differently in people. And it's not just a matter of defining who the high-risk populations are, particularly those over the age of 65 and those with underlying conditions. And I should add that these are the folks at greatest risk, but there is, of course, many others, people who are completely healthy who have very severe disease. And of course, there's one risk factor that's not up here, and that is being unvaccinated. But it isn't the fact that COVID causes variable disease worries me as much as not understanding why. I think if we can come to understand why COVID or polio or any other viral disease causes illness in some people and not others, I think we can target our prevention efforts more effectively. Second thing that bothers me, worries me, is trying to understand the pandemic. We've talked about the fact that there are peaks and valleys, right? So the first peak was in April of 2020, followed by a small peak in July, about 3 months later. This is deaths worldwide. Then it was about 6 months till the next peak. Then it was about 4 months till the next and 3 months. And there didn't appear to be any pattern. Now, if you think about the world, of course, you've got the northern and southern hemisphere. You've got very different weather patterns. But even if you look within countries, so early on, we were following Belgium as it was initially the most heavily impacted country in the world. Their first peak was in April of 2020. The next was in December. That was about 8 months. Then they appear to have another peak about 4 months later. So again, it doesn't appear to be seasonal. Same thing in the United Kingdom, except it went from April to February, so almost 10 months, and then one about 7 months later. If you look at the US, the first peak was followed by a smaller peak in July, about 3 months later. And then about 6 months later, there was one in January. About 8 months later, there was one in September. So again, it doesn't appear to be any seasonal pattern. If you look at Tennessee, about 8 months. If you look at the Ballad Health Service area, about 8 months. So again, it's not obvious where the pattern is. And I think we have to start to understand why there is a pattern. It may not be seasonal. It may have to do simply with how we're reacting to the pandemic, whether we're locking down or not, I don't know. The third thing that I wonder about is what's going to happen in the long term. And here there's really 2 sub-questions: when the pandemic will end and what are the implications of long-haul COVID-19. In terms of when the pandemic will end, we don't know. Right? We've had almost 5 million deaths. It's one of the 12 worst pandemics in recorded history in terms of total deaths. And while the current peak is definitely coming down, we still had almost 50,000 deaths last week around the world. But the reason we can't take that pattern and predict when the pandemic will end is because no one really knows for sure, right? For example, the pandemic could follow this pattern. It looks like each peak is getting a little bit smaller, and so maybe it'll burn itself out in a few months to a year. Conversely, if you follow this sort of up and down pattern, we may see this go on for a long time. We simply don't know. And of course, the worst case scenarios could be it could get a lot worse. We just don't know. And to make that even less clear about what's going to happen, of course, there's wide variations in rates of vaccinations around the world. U.S. is about in the middle of developed countries. But if you look at the map around the world, you see some countries are very well vaccinated and others aren't. And until we know whether we're going to be able to vaccinate people in sub-Saharan Africa, for example, we've got to get a level of vaccine everywhere if we're going to control this pandemic. So it's hard to know without knowing what's going to happen with the vaccine and without knowing what the natural history is to answer the question. And of course, we have the same variations within our country. And then the second question about the long term is also puzzling, and that is, what are the implications of long haul? The CDC calls it post-COVID. Some people call it long haul, post-acute, chronic COVID. It's really all the same thing, which is, what is a new, recurring, or ongoing symptom 4 weeks after your initial illness? And think of these as possibly having three causes. Some are related to the infection itself. The virus has impacted my lungs. I'm going to have lung symptoms going forward. But it's also possible that it's hospitalization or stress or concern or social disruption, loss of jobs. There's so many other things that we don't know how they impact long-term health, and it could be both. What we know so far is these are sort of the symptoms that people are reporting with post-COVID: difficulty breathing, tiredness, difficulty concentrating, pulmonary and stomach issues that should be pain, not paw, headache, fast breathing, joint and muscle pain, and so on. But what we don't know is how long these symptoms will last, whether they'll get better or worse, or whether new symptoms will appear. So right now, all we know is that a subset of people who get acute COVID will have chronic symptoms. We don't know what's going to happen to them. So without knowing what's going to happen globally, not knowing how vaccines are going to go, and not knowing what the long-term implications of COVID-19 are, we simply don't know what's going to happen in the long term. And finally, as an educator, I'm very concerned about how we rebuild the public's confidence in public health. And here again, I think there's two issues. We have to figure out how we can help the public know what information they can trust. And we have to help the public understand the balance between personal liberty and public well-being. In terms of information, it's understandable that people are confused. There is so much information going out from sources that appear to be credible. Some are more credible than others, but it's understandable that the public doesn't know who to turn to. The basic message I like to give out is this: if your car has a problem, you take it to a mechanic. If your water heater has a problem, you call a plumber. If you have a health issue, you call your healthcare provider. If there's a question about a pandemic or an epidemic or an infectious disease, look to the CDC or the FDA. Look to the experts and see what they're saying, because no one is going to know everything about an evolving pandemic early on. And anyone who says they do is probably misleading you, either intentionally or accidentally. So try to find the trusted voice. We have to help the public understand that. And related to that, but different, is this question of personal liberty and public well-being. Right now, a lot of people are arguing that they don't want to wear masks or they don't want the vaccine because of personal liberty. Personal liberty is really, really important. It's part of our self-definition as a nation. But we also have to help people understand that there's nothing unique about trading away personal liberty for the public good. When my father was drafted in World War II, he was giving up the ultimate liberty, he was actually taking on a risk of being killed, right? But nobody at the time was saying, well, that's, that personal liberty trumped the public good. But we do this all the time, right? We have speed limits. We say we stop for school buses. We don't drink and drive. We have restaurant inspections, all sorts of laws of any type. All of these are situations in which we voluntarily trade away personal liberty for the public well-being. In fact, the very essence of a civilized society is that we agree as a people on which personal liberties we will trade away for our own safety, our own well-being, and the greater good of society. This is the essence of our democracy. We don't want to give up personal liberties unnecessarily, but we also have to understand that it is very common and appropriate for us to trade them away for the public good. That is the essence of our society. So my questions that I struggle with, why are the symptoms so variable? Why have we not seen a predictable pattern to the pandemic? What's going to happen in the long term? And how can we help rebuild the public trust in public health? There's a great deal more information about COVID-19 on the College of Public Health website. If you know anyone who would like to receive these videos, please let us know. As always, I'd like to thank Dara Young for editing, producing, and posting these videos. And if you have any questions, any issues, any uncertainty, if you want to challenge anything I've said, please let me know. I look forward to hearing from you. Please be well, and I look forward to seeing you next week. Thanks a lot.